you have a hoarse voice, let me just give you some of the symptoms. You can have a hoarse voice. You can have a change in pitch. Suddenly you're speaking like too high or too deep. Or sometimes you speak and you have a strangled voice. You feel you sound like you're being strangled.
Yeah.
Then there are others may have the volume is very low. You can hardly be heard, and everyone keeps on saying, increase your volume. Or there are those who suddenly speak very loud. So, and those are the symptoms. But the first, when you see those symptoms, the first person you need to see is an ENT doctor. An ENT doctor will look into your throat, and then they will tell you what's causing the change in voice. And voice is so important because just the same way you recognize your friends and family by the facial features is the same way you do with a voice.
Yeah.
You get the phone and you can already tell who's on the other side. And it becomes really stressful when there's a change in the voice. So when we have those symptoms, then there's a voice disorder. Sometimes a voice disorder would be according to the perception of the user. So you may be listening to me and you can't tell there's a difference in my voice, but I feel like, no, my voice is not right. So even that person has a voice disorder, needs to be seen by an ENT doctor, then they'll tell them. So sometimes it's just medication that they need and the voice will get better. Sometimes there's something else going on, and then they will either send the person to me, the voice therapist, for voice therapy. We can have, I think, something that's really common is vocal nodules.
Right.
The small growths on the vocal cords. And voice therapy does help. But then there are those that the first line would maybe be surgery. So when you have these changes in your voice, don't take it for granted. Just have it checked. It's better we screen and find that it's okay, and not screen and then there's something else going on. Yeah.